The founder of Jineng Qigong, Dr. Pang, envisioned a future where Western medicine and Qigong work hand in hand. Now, what does it actually look like when the doctor integrates Qigong with homeopathy, acupuncture, and Western medicine? And not only that, Dr. Aditya Kasarians uses all of her senses to pick up the intangible in a patient, incorporating the environment and even past generations. My name is Thorsten Lüdecke, and this is the Wisdom Qigong podcast. Aditya, welcome to the show.
Hello, Thorsten. Hello, Internet. How are you? I'm so glad that I'm here today, meeting after so long. And I'm ready just to have a very nice conversation together.
Perfect. So please let us know, in which way you use all your knowledge to treat your patients, or what your approach is when somebody comes into your practice and says, I've got this or this illness. How do you approach your patient?
Okay, because my first and cornerstone of education, apart from my Western medicine, is homeopathy. So during the years, especially the methods that I have been practicing, have trained my five senses, and also the sixth sense, which is in Chinese philosophy is called the thought, are very much cultivated, so that when the patient comes, before even enters, you start to perceive things about. So this is a concept that after a while you cultivate also in Qin and Qigong, or I believe in any Qigong schools, if they are practiced very deeply. It is the side effect of any good internal practice, but that's what I believe. And also I believe that medicine is also an internal practice. So when a patient enters, from the way they walk, they talk, they look, you start naturally to understand things about. But the beauty that, as I said, I have received from homeopathy in the first place, is that we believe in, unlike this Western medicine philosophy, we see the person not a completely closed system, which is not related to the outside world. We see it as a system that is very intricately related and in constant interrelationship with other parts of creation. So we have the ability to impact, and also we are very susceptible to be impacted, even though we are not aware of it. So the huge problems that we have, and also we need to visit a physician or consult, for example, psychologist. For any problem that happens in the physical or mental or emotional plane, the reason is that these changes are happening very subtly in the areas of our being which are not in access of our conscious mind. Because if it was, for example, if you have a headache, you could say that, Thorsten, you have a headache. You shouldn't have a headache. These arteries are I need them to get narrowed so my headache comes down. But it doesn't work like that. Otherwise, we didn't need doctors. The reason is that because of these very unconscious and intangible relationships that we have with all creation, the whole impact and our susceptibility. Because if you, for example, if you are aware that something comes to hit you, attack you, then you will have a guard. You will be ready. But because we are living firstly in a very energetic and intangible matrix, So we are absolutely open to whatever that comes to us. So suddenly we land with a lot of problems that we don't know where they came from and how we are not able to treat them because they are happening in our unconscious level, which is unfortunately or fortunately the huge part of our being. So what I love about homeopathy, about acupuncture, or about Qigong, all these internal practices based on Eastern philosophy, is that we address the intangible part first. Because what changes, the imbalance happens first in that matrix, and then it comes and gets translated into physical plane if they are not tended on time. Like the qi, which is, the qi has several, when we call qi loosely in Western translation, we call it energy, but qi is not energy. Qi is also the matter. So it's a spectrum that from one side it is intangible, absolutely not visible, to very dense visible thing, a very visible concept, which we call everything qi. So when this problem, that is this disharmony that happens in this intangible level, is not handled properly, then it started to get more denser, up to the level that we can see it on the physical plane. And unfortunately, then that is the time that people feel that, oh, I have got a problem. But no, that is the fruit of the problem. The problem has started long before. So what we are trying to understand in our patients, as I said, my main treatment part is homeopathy, is to understand in all planes what are the imbalances of what we call the vital force, that it shows itself in your dreams, in your fears, in your profession, even in the profession that you choose. You suddenly open your eyes and you see that you have chosen often absolutely an imbalance. But the thing that I have to tell it now, despite these, I have many patients that they come and I can see that, oh, how come they have chosen their profession? And this is absolutely compatible with the remedy of their imbalance. But that also is their very strong point, because it is from that point that they can, they can use their potential to fulfill their mission in life.
Very good. I understand. My question to you is, do you need to actually identify the underlying issue? Do you need to, because you said it's all happening in the unconscious, or most of it is happening in the unconscious. Do you need to be specific and say this is the reason? Or does your energy work, basically just clears the clouds, clears the energy? How specific do people have to know what the underlying problem is of their disease?
Mostly the people do not understand the underlying problem. Sometimes it's interesting, maybe out of 30, 40 patients, even the case-taking session, which usually takes 2 to 3 hours, is enlightening enough that the problem, even though physical, totally gets managed for a huge long time. So I have few patients that they cannot tell you, okay, I got like this, I know this is my problem. That doesn't happen. But kind of mirroring happens, that you are in front of your problem. And in homeopathy, we have the similar cures the similar. So kind of you become your mirror and things start to happen. So I don't even need to prescribe any medicine. So in that times I said, okay, we just wait. And sometimes we have waited up to 1 year for the problem, for the patient to actually need a physical remedy. But the point is that I have to know where the problem comes from. Otherwise, especially in pathologic cases, you will certainly fail. I say 100% certainly it will be a failure if you do not know where the problem comes from. It will be a blind work because, of course, energy will change during any good treatment, but something that has turned into a matter like MS, like deep pathologies like diabetes or like, for example, renal failure, deep cardiovascular disease, anything that you see really a matter change, you have to be very sure of the steps that you are taking. Otherwise, you will surely have the relapse. The thing is that we have to this is very Qigong and Chinese medicine idea, that we do not only hold our imbalances, we carry at least 3 generations before the unfunctional or dysfunctional, I don't know the correct word, patterns. So, for example, I don't know if you have heard, for example, my patient says that my mom's grandmother had obsessive compulsive disorder. Nobody in between has, and this child has. So how does it happen? It happens because we shouldn't forget that in treatment, we have the patterns of 3 generations at least before that will impact us. So, as I said, in pathology cases, we really have to know what we are doing. Also, very interestingly, I have to say, which I think it might be of benefit to my colleagues also in Qin and Qigong team. I tell it through an example of one of my patients, which was very interesting for me. A patient of mine, about 30 years old, came with a retinal problem in her right eye. So when I started to navigate, and we ask about childhood, we ask about, for example, fears, dreams, everything. So out of blue, she said that her grandparent, which died very early, had glaucoma that had resulted in blindness in his right eye. And interestingly, this person's wife, means the grandmother, in her childhood had an accident that a stick had entered her right eye, and blinded her. So that was just a story for this patient of mine who was only 2 years old then. But it is interesting, even knowing or seeing the information of that incident that had resulted in blindness in right eye of the grandparents had resulted in a pathology of retina out of blue in her right eye. So that is how our unconscious world works. And it is very important that we can really tend to, we are capable and armored, at least to understand that, okay, this part is coming from which part. And if I'm going to have a persistent and complete cure, I have to address all aspects of this person.
My name is Leila Cupido, and I'm the project manager of the Students Hub. Our team is constantly adding events, teachers, videos, and other resources to take your practice to the next level, improving the quality of your life and the life of the people around you. We do this work for you, so please use it. Hunyuan Ling Tong.
This is a very interesting example because if I understood you correctly, you're saying that in your patient where this retinal problem came out of the blue, there was nothing really happening physical, but the problem was there that this patient was picking up the information from the 2 other generations who both had, a problem. And it's kind of the unconscious says, oh, I've got a problem at my right eye. I need to, so this is why I can't see properly. This is why I developed this retinal issue now. Now, if you know that, if you find this out in the conversation, now how are you resolving this?
So actually, then I have to I just go to my homeopathy part mostly, because we have this apart from the remedy that we give to this person, but which like upon the patterns that we currently see, we also have the remedies that we need to prescribe as intercurrent remedies to address the problems that come from previous generations, and they have their own specific categories of medicines. So these are the things that I have to really address. Actually, from Chinese medicine point of view, because I have just incorporated it into my practice, and actually I have to say it is very difficult to have both TCM and homeopathy in your brain. And I'm just very slowly incorporating that in my practice. But right now I cannot say netly how, from Chinese medicine point of view, these patterns that come from old generation, how we are going to address that. I have colleagues that they can probably say more about it. But in homeopathy, we have medicines that we need to prescribe. Otherwise, even though this patient comes and say that, okay, you gave me remedy and I'm seeing much better, I have to wait for a relapse because I haven't cleared that layer.
Right.
So I hope this is a brief but maybe meaningful concept, because we have to take it very serious in any kind of treatment that we do, because patients, they come and when I was previously, I had visited few places that they were doing very deep energetic works, and I could see like the healings in front of my eyes, and they were brilliant. But among them, there were people who had very severe relapses after a while. They would come after a year with relapse and then they would die. And that was always my question, that if a healing was a healing, why this should happen? Yes. Then I started to see that it is not only our patterns. Imagine that this girl was only 2 years old when the grandparents died. So people think that as a child, we are a child, but the point is that all our senses are wide open to grasp all information. Even the patient, when she was telling to me this story, she didn't notice that. That was the beauty, that she didn't notice. She was saying that in the right eye, that was the problem. Then she had the problem in the right eye. And I said, how beautiful the unconscious work, because I'm, as an observer, I can see what she's not able to see.
That is a very powerful example, Aditya. And what you mentioned here is something that comes up often in the community, because we know that when we work with Hunyuan Qi therapy, for example, or with Qigong, or with any kind of Qi healing, that very often we have incredible results. And for some people, it just stays forever. They stay healthy forever. And others have these relapses. And then the big question is, well, how comes? But I think you explained this beautifully by saying, yes, you can do a lot with energy work in the moment and transform something. But if the underlying cause hasn't been dealt with, then, once you let go of the practice and continue with your normal life, the cause will just come back and create whatever was there in the first place. And then suddenly you realize, oh my God, this illness or disease has come back. And so the point with the underlying cause, that's really something that I think we all should put a lot of attention to. And but what I understood when you first started, and please correct me if I got that wrong, what you said is that in the conversation that one had with a patient, a lot of the information is mirrored, and I learn about myself in the conversation. And sometimes that already resolves the issue. Now, would you say this kind of resolution is also permanent, or would you be worried and said, okay, we've resolved it now in the conversation, but we need to go a little deeper. We need to see what else is there and clear that up as well?
If you allow me, I think examples will be more explaining. So I never just decide that, okay, to this patient, I will not give remedy. I will wait for 1 month to see what happens. Sometimes during the case taking, despite the patient even doesn't know what's happening, she's just narrating. It is not mostly every patient says that we are feeling so good after we have talked to you. Despite it is not a consultation, psychology consultation, but kind of touching the unconscious part, actually is a start of healing. So I have to say that sometimes upon my own, like some feeling in my heart, I say that, okay, let's wait. I feel that something will change in this person after just by itself without doing anything. But I don't leave the patient for 1 month. I say, okay, tell me about 1 week, how you are feeling. And then after a week, if I feel that, okay, now things have started to happen by themselves, so let's give enough time. 1 month. Every follow-up, even though I don't prescribe any physical medicine at that time, happens every 3 months to 1 month. I do not leave the patient, but every time I decide, should this person needs a remedy or should I wait? So it has happened that I remember there was a patient who was sent to me because of very, 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 very severe vertigo. She was brought, the people were holding her from her armpits. And she told me that she had gone to a neurologist for the last 2 years, but this severe vertigo is not leaving her. So I took her case and I knew the remedy, but somehow I felt that I want to do a Qigong therapy for her. So I find my place also upon how it comes to my heart where I place towards the patient during the treatment. So obviously she couldn't move that much. She was sat and I stood on her back behind her. And I naturally put my hands on her shoulders just to calm her down, like just close your eyes. The moment that I put my hands, the whole world was whirling around me. I was like in a centrifuge device, like just moving. All the world was moving around me. And then I said, okay, I took away my hands, everything stopped. Then I put my hands, everything was moving. And then I started to clear up the meridians. That times I didn't know that much about the meridians. Now I'm speaking, but that time I started from my own way, just connecting to the source of healing. And then I don't know, I think I waited for 30 minutes, maybe, I don't remember. But finally, everything stopped. The moment that I put my hand, I didn't feel that vertigo around myself. I said, okay, I'm not going to give any medicine now, although I know her medicine. Let's see what happens. The vertigo went away for 2 years. After that, I haven't met her. But for 2 years, she didn't even need the remedy. Also, there are patients that for 6 months, I don't give them remedy because the first session was so healing by itself that even physical problems went away. So I say I wait. But I do not fear that the symptoms will come because they will come. It is inevitable that things get resolved that easily. I shouldn't take it that easy, I think, as a practitioner. I'm a little bit OCD about how I practice, actually. I always take the other side, that I have to take my steps very correctly. So I'm not afraid that the symptoms will come back because I know they will come back because a person is not made of one layer. We have many layers that they need to be addressed. And this one point that is very interesting to note is that maybe I have a headache, which is, if you think that like an onion that has many layers, imagine that in the first layer, there is this migraine. So with any medical treatment, like homeopathy, like TCM, like Qigong, anything, when I've taken it superficially and I have forgot that we have other layers, and I have just treated this very superficial treatment, then everything the patient will say that I'm feeling very well, but this headache will be staying there and telling that you have this layer still staying here. The second point is that maybe that layer is that migraine is very much anchored to very deep areas of this person, maybe to previous generations. So maybe if I give the remedy now, the patient is much better. Think that the patient has come with 5 symptoms. 3 symptoms get better with my first treatment for the first 2 years. She's very good. This headache and, for example, this for example, bloating. They are they are better, but not better. The intervals of my headache have increased, but like maybe instead of every week, I have 2 months once I have a headache. Then you continue and you say after 2 years of treatment, these 2 symptoms are still there. So something is happening and I have to be cautious. So either I have not prescribed the correct remedy from the first hand, because we have a lot of modalities that can heal the patient superficially. Maybe since the beginning, I have not prepared the correct remedy. Maybe if I had been more conscious and cautious, I have diagnosed a remedy which covers all these 5 symptoms. But also it happens that I have done my job well and 3 symptoms are related to superficial layer. And I have to take case and see if there is another layer that needs to be addressed, because some infectious diseases that happen during the childhood also leave their traits and they create another level of disease, layer of disease that need to be addressed separately. So maybe that headache which I have now is related to that level, or no, even it is related to the level of my previous generations. So these understandings comes in every month's follow-up. As much as you start to know your patient and also you know your relationship with your patient, how unprejudiced you are when you sit in front of the patient. That is the first and foremost advice that the founder of homeopathy has told us, that the physician should be very unprejudiced, because the moment that you think that, okay, this is the problem, that is where you will fall. You will just be very open to see where these problems are coming from. And also do never forget about the childhood. All our brain connections happen during childhood. So maybe upon a very, very funny but emotionally heavy incident that happens in one's childhood, it shouldn't be a very gross thing like a rape. It can be only a vase of flower falling down and a huge sound comes. Just that fright for a child is a huge thing. So that can make a pattern. So nobody should forget about one's childhood.
And the treatment you do then, Aditya, is so. For example, you in the conversation you discover. Let's take this vase as an example. The vase falling down. Would you then treat it with a homeopathic medication so that this memory kind of loses the power over your patient, or how are you dealing with these things? Or is talking about it, becoming aware of it enough to resolve it?
Sometimes the talking itself resolves it. Even the patient doesn't know that the talking is resolving, because when you are case taking, you enter the unconscious area. It is not a conscious conversation. It is absolutely an unconscious based conversation. We are using words, but it is an absolutely different space. But also, for me, it is important. Maybe the patient doesn't understand that that was the incident. So I don't say that I choose, for example, in the incident of that girl with the retina problem. I tell that, okay, so the injury for the grandparent, this is the remedy I have to give her. No. Even coming to that layer means that I am in the right track of my case taking. Whatever is happening is healing. And still, it doesn't mean that whatever I prescribe, I will cure the patient. It is not. I have to decide the correct remedy. But these are hints that show me that I am taking my case into the core of the unconscious in a good and correct way. So during that, anything can happen, and spontaneous healing can happen, or no, even if the patient doesn't say that I have just transformed, I'm transformed, I'm 100% sure that the healing has already started. I have to tell something. I have this patient, and it made me goosebumps. Last week, what happened? She comes for me for a very, very severe depression after she had her child about 9 years ago. She visited a lot of physicians, homeopathic, also Western medical colleagues, but she was not getting better. So few first times, that's also a question for me. I'm just telling it loud because I gave medicine, and I knew for some reason, I know that it was correct for that time, but we had a relapse after 2 years. Then we had a good medicine, then after a relapse after 2 years. So now when I see her case records, when I watch, I see that I have done it very correctly every time, but I had the relapse. So it means that depression stems from much, much deeper levels. So I have to reach that deep. There was interesting thing happened last year when I took her case, and she was very good for 1 year and a half, absolutely excellent. No one minute symptom was left. So during the conversation, she started, because I go to the sometimes childhood scenes, she was talking about a willow tree beside a river. So that was something that came up. And in one of the methods that I practice, we search for patterns in childhood scenes. And then I said that, okay, where else have you seen this willow tree with this river underneath? So she said, okay, in my grandfather's house, grandfather's village, in some other city. And then upon the whole case, I finally prescribed obviously a good remedy at that point, because she was absolutely fine without a minute complaint for a whole 1 year and a half. And then she had a relapse. And every relapse, this time relapse came with a trigger from outside birth. So after 1 month of just changing the doses, I thought, okay, now we have to retake. And then about 3-4 months ago, I started to prescribe a remedy that is now obviously the correct thing for addressing this layer. But last month, she called me that I am very weepy because I'm remembering some things from my childhood, and I have to tell you about that. That why my mother did this to us as her children. And I said, okay, what? She said that she narrated 2 stories because their father died and the mother was taking care of 4 children, and she was not able to handle the outside work and the inside work, and she was the youngest. But the very, very interesting thing that she said, and I get goosebumps. She said that I don't know why my mother took us to see this execution scene in the city. I said, where? That there was a willow tree with a river underneath. That was the tree that execution happened there. And I thought, that was the willow tree. That the pattern that was created in her childhood was not that willow tree and the river in her grandfather's village. It was this willow tree that time she was not remembering. And despite she was not good at that session, she was just weeping, I said, okay, I'm not repeating the remedy because the remedy is doing her work. It is just bringing up the trash out of the unconscious, despite she doesn't understand, because I had that case. Now I know that this is very, very invaluable thing that is happening to her. So at that time I waited. She was not well. It doesn't mean that every time. It is very important as our practitioners, my colleagues, to have patience when they are treating someone. Sometimes the patient comes and they say, I am fabulous. You might decide that you need to repeat the remedy. It is upon your perception of 5 senses that you decide, not upon only what the patient says. On the other hand, but most importantly, is that sometimes the patients say that I have headache, I'm not feeling good, but you do not find any clue that you need to repeat the remedy. You just need to wait, because all the trash that comes up, they don't need to be suppressed again. They need to come out. So why we don't allow them to come out enough? So what I've also learned in homeopathy is that when you have doubt, you just wait. If you are not sure that this person in this session needs any kind of treatment, you just wait, give some time and see what comes up.
That is all very, very interesting, Aditya. And I think you are bringing together a lot of different ideas and wisdoms in one practice, because you're really using all of the skills and all of the wisdoms from various parts and combine it. And something that also makes you very special here, if I might say so, you are a very receptive woman. So when you say you can receive this information, you see things in people and with people, and you trust your intuition. And now that is not something a lot of practitioners, a lot of doctors do, because they've learned, okay, this is the problem, here's the solution. This is the problem, here's the solution. It's not a mechanical thing, really. It is far more than that. And I must say, I mean, it's very impressive, and I don't know many doctors who work like you. And so this is a wonderful thing. And as far as I know, you're taking patients in your practice in Iran, but you're also doing some online work. Is that a possibility, or is it more difficult for you to use your senses and your intuition? So please tell me a little, how that would work, or whether there is a difference.
No, absolutely. I have brilliant treatments online also. I think what I believe, as I told earlier, in medicine for me is an internal practice. It is my what do you say? My praying. I don't know what you say. And that is what I believe. I do not say that, people who come to Eastern medicine think that, Western medical practitioners are, no, they are very mechanical. My very good teachers are from Western medicine because of the quality of the person who they are. For the heart, which is very open for the patient, you see that love that comes, and that is more important for me. And this is actually inherited from my family, but in my heart, I have a room for every single person to extreme, it is that much a special place that everybody has. If person sits in front of me or we are connected virtually, I don't feel that it hasn't showed any problem or any interference. The distance it has never caused such a thing. And this intuition comes by time and by practice, not intentional practice that I want to progress my intuition. No, your constant practice and your persistence is that you make yourself a better quality, a better version of you, a more efficient version of you. Then upon the needs and requirements of the mission that you have, things will download by themselves into your being. It is not something that you do. They will happen to you. They are just grace that comes up to you.
That brings me back to your fundamental idea of Qin and Qigong, that we approach everything with an open heart and an open mind. And I think if we take that approach, then it is easy to be intuitive. It is easy to understand what's going on with the other person. And I think you've just integrated that in your work in a very, very beautiful way. So Aditya, that was a great, brilliant conversation. I can't thank you enough for that. I think there's a lot of wisdom in here, and I hope that the listeners will all benefit from that. And obviously, we'll leave the details how to get in touch with you in the show notes. So if everybody feels like, wow, this woman could be, somebody who helps me with whatever is going on in my life, feel free to get in touch. And I hope we're having another conversation very soon. Send all my love to your family. I know you've got a fantastic family back home, which is also obviously a blessing. And I'm sure they've played a big role. Because you were talking about about past generations, I'm sure they've passed on a lot of the skills and of the beauty of who you are as a woman onto you. So send my regards to her and to them, and thank you one more time for this great conversation, Aditya.
Thank you so much, and I may add something.
Please.
We are all, and I am gratefully standing on the shoulders of giants. So gratefully, as I am standing on as you said, the shoulders of my parents and also my previous generations, because they are the production of the previous generations. But also I am also standing on the shoulders of the masters of homeopathy, Chinese medicine, and also Qigong. But specifically, as we are in Qigong community, I cannot thank enough. I'm really grateful to Master Liu and also Brita, because without them, also my journey wouldn't start in Qin and Qigong. What I love about Qigong, our school of Qigong, Qin and Qigong, is that Master Liu reminded me of how important my own, the information that I put into my own energy system means. Because coming to medical school actually takes away your faith. That is something that I think many people will agree with, especially in Western medical school. You totally lose your faith at some point because you see that people succumb to diseases that are incurable. And you, despite within your heart, you are not like that, but you unconsciously start to believe. I think that I came to Qin and Qigong school at the right time, because I was in the most fragile time of my, I think, mental pattern about all these healings that happen and their relapse and the deaths that happen because of the diseases, which I couldn't accept. That how come? How is the treatment that doesn't work? But coming to Qin and Qigong, it reminded me that how powerful our mind is and how powerful my mind is to impact not only my health, but others, that even thinking can change and create. So one point that I have to add is that a lot of maybe relapses also that happen during the treatments, if we are only energetic based doctor, is that we also have to train ourselves to go very deep. Even if I am gonna at this point only treat a person with Qin and Qigong therapy, I might not be continuously successful in taking every deep pathology case into complete cure. It needs a really, I think, cultivated being, and we need time for that. So it doesn't mean that we have to get disappointed if a patient comes with a relapse. It tells something about the patient, but it also tells something about me. I need to progress. And the question is, and the thing that I have to also remind kindly and humbly, is that every single disease has the possibility for complete cure, even the gravest ones. The question is that, is the patient treatable or not? That goes to a lot of factors, including the the destiny that the patient has come, about the fire of life that the patient has come with. So everybody has a span of life, a defined span of life, defined jing that has come. So we shouldn't forget that we are treating people, not the diseases. So any single disease can be treated, but is the patient treatable or not? I am responsible for that part. I have to correctly diagnose the patient. What is the diagnosis? I have to understand the patient in all planes correctly: physical, mental, spiritual, functional, cellular, physiological, everything. And also I have to know myself very correctly. And the very important thing that I have to remind is that when you sit with a patient, forget about yourself. Whatever, we should be very aware that we shouldn't take our state into our conversation, because it will obscure our senses, and the results will absolutely be different. You will not see the things that you have to see in the patient. But after all, the mind has the ability to treat everything. And I really hope, I always tell my patients that if you are praying for me, please pray that I have my magic stick, that only with one stick you'll get better, cure forever. That is my wish for myself, and this wish for all my colleagues. But it needs time and cultivation, so we have to be patient.
Now, I know I wanted this. I thought this conversation was over, but we are back right into it. But I do have another question here, because I thought you said something incredible when you said every disease is treatable. But the question is the patient treatable? Now, what does that mean for you, or the patient is treatable or not? And if you are with someone where you know, oh my God, he or she is not treatable, can you actually change that so that he becomes treatable?
Yes. First, that we have to be very clear about this in our thoughts, that every single patient that has come, cancer, renal disease, end-stage diseases, they are treatable. And we have to be very faithful about it. But we also have to respect the life mission of that person that we are not aware of. We have not that much of, open senses to understand everybody's life. We are not the masters. At least I am not. There are many factors that I have to take into consideration. I have to do my work correctly. My work is that I have to send correct information, but not to give false hope. This is the important thing. You cannot sit in front of a cancer patient and say that I will cure you like this. It doesn't work like that. You have to be very honest, but lovingly honest. And also, you have to be sure that you are, because we have grave disease, and any mistake will lose time, waste time. So you do not have much room to make mistakes. I have to have correct diagnosis. Do not take any patient without any diagnosis. Make sure that the patient has concrete Western medicine diagnosis that you need. Then attempt to treat. The second thing is that whatever modality that you are treating, be very faithful and very knowledgeable about the principles. Like I'm practicing homeopathy, I have to know which are the pillars of case taking, prescribing, following up. And I have to give my give my prescriptions correctly. And then I have to, obviously, if I'm in that state and I have the intention that I have to, and I will cure this patient, you are moving that energetic circle in favor of the patient, because saying admitting or not, there are very adverse energetic fields also that are affecting us because we are not conscious enough to, or not cultivated enough not to be impacted with them. Even easiest is that getting common cold. As I said, you have to keep your correct mindset that every patient is treatable. You shouldn't come to a cancer patient and say that, oh gosh, what a grave situation. No, the moment that you tell that to yourself, things will move in not good way. You have to say that, okay, we are in a grave situation and I will do my best because I know the way. And if you do not know what to do, please ask for help. It is very good in some diseases that different people from different modalities, knowing what they are doing, can contribute to one patient to propel the healing. I tell something interesting to you because, if I may, I had I think 2 years or 3 years ago, I had a referred case from another province. She was a maybe 25-year-old girl with pancreas cancer in the stage, and she was sent home to die. She couldn't eat or drink anymore. She was extremely cachectic, and she was not able to talk, and she was in grave state. The family called me, and I said, okay, I don't know what I will do, but let's see. I just saw her for 5 minutes. I took the symptoms that there were visible, and I prescribed. After a week, they called me that she's eating, doing the work by herself, walking around. And even if she asks for help, she has enough energy that the mother says that you go and fetch it by yourself. And they have just gatherings together. They are happy. And after a month, she died in sleep after a very enjoying a party that they had in their house. So that is the beauty of a correct treatment, be it homeopathy, acupuncture, qigong, anything that can bring the patient. It can bring a palliation that it is absolutely not accessible. I can boldly say that in Western medicine, it is not possible. The patient actually didn't die of pancreatic cancer. She died of, she just passed away in sleep. And I think this is one of the most beautiful deaths one ever can wish. So it means that the energy and the essence and the vital substances were all already depleted during the disease, and they were irreversible. Whatever I could do, that was not, the time was done. But she died very, very, very gracefully. That is, I think, a gift that also we can contribute to. Also, I had one patient, and my first patient actually, that happened in this way. It was a year after I started my practice 9 years ago. So he was a 50-year-old man who had 7 consequent brain strokes. So the spasm in his body was so much that all his teeth was broken. He was given this tube to feed, and he couldn't speak. He was sent home. So they called me. They were from Tehran, and that time we didn't have video things. So I just took the case by phone and from the surroundings, because from the people around, because he couldn't talk. And then we continued the medicine for 6 consequent months. And then on the 7th month, the girl said that my father is speaking 25 words. He's using his hands. He's eating. They have started dentist work for making the teeth in a better state. And he said that if you don't if everybody's seated, then you cannot notice that who is my dad, because the only problem is that he cannot just walk. That is the only problem left. That was the progress. So after I think 8th month or 9th month, because he was so happy, he started to play volleyball. And because he was so happy that he played volleyball, he had a heart attack and died in the play. So, but that was the beauty, because the family said, we are so grateful because he died when he was so happy and we were so happy. When the time is set for a person, but we can absolutely impact the quality, and it directly is related to our quality. How we are knowledgeable, how skillful we are, and how cultivated we are.
Those are very powerful words that you're saying there, because we know that all our time is limited on this planet, and that is also something to be at peace with. But the question is, how do we, when the time has come, how do we leave the planet? And what you're describing here means it's a very different experience than that of suffering and that of pain. It's a joyful experience, and that in itself has obviously a great value to all parties, to the person and their family and the surroundings. So I understand what you say when you say every disease is treatable, but not every person is. There are some limitations that we don't understand, and we also have to be at peace with that. So I think this was a very powerful interview. Thank you once again, Aditya. And I hope that we have another opportunity, with this podcast, maybe at a later stage, to have another conversation and learn more from your incredible knowledge and wisdom here. So thank you once again, and I hope to hear from you soon.
Thank you so much for the time and the time and opportunity that you gave me. I'm very also glad when I share my ideas, I also learn from them. So it's also a very nice opportunity for me to rehear the principles of healing.
Wonderful. Thank you very much, Aditya.
We trust you enjoyed this conversation, and we invite you to subscribe to our podcast so we can stay in touch and notify you of future episodes. We will end today's episode with the 8 verses meditation performed by Qin and Qigong teacher Katrin Hendricks. Enjoy. To get your free ebook on the 8 verses meditation, please check the show notes below.